Did you know that not all STIs are symptomatic and you can have an STI without knowing? Hello, thank you for taking this short course on STIs by Zari Africa Academy. Let's learn about STIs. STI is an acronym for sexually transmitted infections. These are conditions that can be contracted mainly from any kind of sexual activity that involves your mouth, anus, vagina, or penis. Most people believe that it is only transmitted from vaginal penetrative sex, but that is not true. STIs can also be transmitted during pregnancy, childbirth, and through infected blood needles or objects. Sexually transmitted infections are very contagious, so it is very recommended to get tested regularly because you can have and even pass on an STI without knowing. Most young people would wonder, what is the difference between STI, sexually transmitted infection, and STD, sexually transmitted disease? Well, there's no real difference, just two different terminologies to describe the same condition. What really causes STI? STIs can be contracted when bacteria, viruses, or parasites find their way into your body from body fluids like blood, semen, urine, and saliva during sexual activity. But that's not all. STIs can also be contracted through needles that contain blood. They are very contagious, so get tested regularly. How do you get tested? A sexually transmitted infection test is a medical test that will help determine if you have an STI. A medical professional healthcare provider will assess your symptoms and provide a test to ascertain the cause. There are several tests for each type of STI, like urine test, cheek swab, blood test, discharge of fluid sample. But don't worry, STI testing is mostly painless. There are two types of STIs, the curable STIs and the viral STIs. Curable STIs are the most common types of STI. They include trichomonas, pubic lice, chlamydia, gonorrhea, and syphilis. While the viral STIs have no or very limited treatment options, they include HIV, genital herpes, simplex virus HSV, viral hepatitis B, human papillomavirus HPV, and human T lymphotoric virus. Did you know that no symptom does not equal no STI? Yes, you could have an STI without any symptoms. But if you do have symptoms, it may look something like this: vaginal discharge, genital ulcer, burning, itching, and lower abdominal pain, bumps, sores, or warts on or near your penis, vagina, mouth, or anus. So, how do you keep yourself safe? Abstinence is the best and safest option. But if you are already sexually active, condoms are a very effective method to protect against STIs. Do not forget to get tested regularly. Early diagnosis can prevent further complications and transmission. You may be wondering, what if you already have an STI? Well, if you suspect symptoms of STIs, I want you to know that it is not shameful to seek help. Early diagnosis can save lives. Get tested, get diagnosed, and get started on treatment to keep yourself and your loved ones safe. Well, that's the end of this short overview on STIs, and I hope you learned something new. Don't forget, whether you're an advocate, activist, parent, teacher, or adolescent, the goal is to learn to share. So go ahead and spark up a conversation on STIs in your community.